Hello, hello. Today's Insta Live is all about gut health. What is good gut health? What does it look like? Why should we care? And what can you do about it? As we know, January is a month when a lot of people start to think more acutely about their health and what they can do. So we wanted to do a series of different Insta Lives to cover topics that are related to health and very topical areas such as gut health, so that you can get the right information and that you can know where to go and that it's based on science. So today I am joined by fellow dietitian Anna Pettit, who works for the Gut Health Clinic, and she is going to be answering lots of these around gut health. And Anna is a specialist gastro dietitian, has worked with patients and clients around lots of different conditions to help them get back on track with their gut health. Hi, Anna, how are you?
Hi, Sasha. I'm very well, thank you. How are you?
Yeah, really good. Thanks so much for joining me. I've given a quick intro to who you are, but perhaps you want to just give a little bit of a summary about your background and why you became a dietitian.
Sure. I mean, I've been qualified for 12 years now. I started off as an acute dietitian in hospital. I did a wide range of patients with chronic conditions, and then I decided I fancied a change and actually moved abroad for a couple of years. So I lived in Dubai, where I worked as a freelance. I worked with bariatric patients, diabetes patients, and that's where I became more and more interested in gut health and how gut health actually shapes our overall health and the risk of chronic conditions such as diabetes and obesity. I then moved back to UK and got involved in a lot of community projects and ended up working in community and also doing some private work with the brilliant gut health clinic, where I've been since April, and really focusing on seeing patients with functional gut conditions, but also, inflammatory bowel disease, celiac disease, any sort of disease of the digestive tract, if you like. So that's my intro. And again, thank you for inviting me to have a chat with you today. I'm really pleased to see you.
Well, what fantastic experience you've got. And we have got half an hour to do a deep dive on that very small topic, gut health. So I'm going to start shooting some questions at you,
Sure.
And let's see how many we can get through. And for anyone who's joining us, thanks for joining us. Feel free to send us any questions that you have related to gut health. So I guess my first question is, what is gut health and how do you define what good gut health looks like?
Right. So that's an interesting question. And I don't think there is a clear definition of what gut health is. I think it's definitely a term that has been used more and more in the media and by us dietitians and nutritionists, as more and more research has gone into gut health in the last couple of decades. But I think you could almost see it as an overall health of the whole digestive tract. So we know that digestion starts at the mouth and ends at the rectum. So all the organs that are involved in digestion, I think when you're assessing someone for good digestive health, you want to make sure that everything is working well, you are digesting, you're absorbing the nutrients, and also a part of that, which we are going to be chatting about, is your gut microbiome, your gut microbiota, that actually plays a central role in making sure that you are symptom-free, for example, or you are disease-free, and your general well-being is sort of well and healthy as a result. So I think, yes, generally the consensus is still sort of out on the general term what good gut health is. The same as for what is a good gut microbiome is. I think we know that generally a good diverse gut microbiome is better than less diverse one in terms of the general health. Actually, I've just realized that I want to talk about gut microbiome and gut microbiota and the difference between the two. So the gut microbiota is the bacteria and the microbes that live in our gut. Actually, it's not just the bacteria. We've got the fungi, we've got yeast, different kinds. We've got viruses and parasites living quite happily in our gut. And gut microbiome actually refers to the genetic material as well as the actual microbes. I think those are the main differences. So for the purpose of today's talk, I'm going to be referring to gut microbiota, so the bacteria, because that's what we know more about. So the effect of bacteria on our gut health, the effect of bacteria on the overall health.
Perfect. I'm sorry, it started with a really loaded question. It's quite a difficult question, that. And I think because we are learning so much, I feel like we're just at the tip of the iceberg when it comes to research around gut health. And, you know, this area has just exploded just in the last 10 years. And I suppose the thing is, we're dealing with something that's living. We've got lots of different bacteria in us. And I suppose there's also a journey. So I suppose there isn't just a black or white, this is what a good gut looks like and not a good gut, although we're learning what some of the differences might be. But also there's lots that you can do, I guess, just to start getting you on that journey towards a better gut.
Of course. And I think everyone is different in terms of even their definition of what their good gut health should look like. Some of the people that we see in the gut health clinic see it as being symptom-free because they've lived with symptoms of bloating and wind or diarrhea or constipation for such a long time. So they just want to reduce those symptoms, and that's how they see that they improve their gut health. For others, it would be, you know, depending where in their journey that particular person is. For others who are much more experienced and already are good eaters of a balanced diet that is mostly plant-based, you know, there are a few additional things that we can suggest as dietitians in clinic. And I think, you know, as you said, there's no bad and good. Still, we don't know what an ideal gut microbiome or gut microbiota should be like. What I want to mention at this point is that because each gut microbiome is so different, it's like a fingerprint. So it's kind of difficult to compare it to anything. So that's why we still don't know what an ideal gut microbiome should look like. So in terms of bacteria and other microbes that live there, I'd like to use the word of conditionally bad. So it means that in some people, that bad bacteria that, you know, like C. diff, for example, E. coli, can live in their gut quite happily and not cause any symptoms, whereas in others, especially if they're immunocompromised, so say they're going through cancer treatment or they've got HIV, or they generally are unwell or had a gut infection, that's where those types of bacteria tends to overgrow and cause symptoms. So yeah, conditionally bad is probably a best term to use rather than, you know, getting into black and white category and saying this is bad and this is good.
I like that as a definition. I think that's really helpful. And why should we care about our gut health? What is this, you know, we've spoken about not having symptoms, but you know, from what I'm seeing, gut health seems to have such an impact on lots of different areas of our body and our general health. So yeah, what does the science say?
Well, of course, because I think when you're looking at the functions of the microbes, of the gut microbiota, that, you know, we see a lot of evidence in the connection between the brain and the gut. Obviously, there is more and more research is being thrown into the gut-brain axis and how the composition of our gut influences our mood and the risk of depression and actually even the risk of Alzheimer's. We also know that 70% of the immune cells live along the gut. So, you know, immune function, supporting the immune system is really important through the gut microbiome. Also, they digest the microbes digest fiber, the fiber that we can't digest as humans because we lack certain enzymes. And whilst they're digesting those fibers, there are obviously different types of fibers that we can touch on a bit later on. They produce a range of beneficial compounds such as short-chain fatty acids like butyrate, propionate, that keeps the gut lining healthy. It strengthens the barrier, so those sort of toxins or other bits and bobs that shouldn't be entering the bloodstream are kept at bay. So that's why we need that really, really strong protective layer. And that's why we need to keep that bacteria going. We need to feed that bacteria so it produces more short-chain fatty acids. Also, another role is in terms of vitamin production. So some of the vitamins are produced by the bacteria, so like B vitamins, K vitamin. So hence another way to boost your health is obviously through feeding your gut bacteria and then producing vitamins. I've already sort of mentioned digesting the fibers. Again, to recap, the immune function is really important. The vitamins and also the protection. I think those functions are essential for our overall great health, if you agree. And obviously, if you're thinking about gut health and focusing on certain things to improve it, to boost it, you can actually totally say you're looking after your long-term health. You're reducing the risks of certain chronic conditions such as diabetes, obesity, some of the organic disease of the bowel, such as IBD, inflammatory bowel disease, and certain cancers like colorectal cancer.
So I guess the big question that everybody wants the answer to is, what can we do to improve our gut health?
Sure. So I think there are a few things diet-wise that we can certainly do, and they're easy to do. I think it's always, there are a wealth of information on the internet. You know, when we see our clients in clinic, they come with a lot of questions because they can see some of the products that are advertised as a golden pill to sort all your problems out and create like a perfect gut health as a result. The less expensive and more efficient way is to actually look at the diet, look at how much plant foods are in your diet. And that could be done at home if you're just beginning, you know, to think about improving your gut health, or it could be done in clinic if you need a little bit more support in terms of face-to-face from a dietitian or qualified nutritionist. I think definitely sit down and have a look, review your diet and see what you're eating on a regular basis. Try to write down things that are sort of staples of your diet and see, are they plant-based? Is there a balance of things in your diet? Because it is all about balance as well. But in terms of the gut health, we want to ensure that it sort of revolves around the plant food. So you make it as you make it your staple, and then you add in the things. So you add healthy proteins, whether they are from the plant sources or from animal sources, like, you know, fish, eggs, dairy, fermented dairy, yeah, just see how many of those you have a week. What we try to do in our clinic is to get people to eat, obviously to meet their fiber requirements, which I'll touch on a bit later on, but to actually think of it as plant points, which I think is a brilliant concept. So for each new plant, you actually get a point. And for herbs and spices that you use, you get 1/4 of a point. So you should be aiming for 30 plant points per week. And they should be coming from sort of different colors, different types of plant foods. Because if you think about it, you want to ensure a great variety, a good variety of different types of fibers, because different microbes love different foods. They're just like us. So you wouldn't want to give them just one food, because that may just feed one type of a microbe. But if you give them a great variety, you've got a good chance to have a really diverse microbiota, which will actually confer a lot of health benefits to yourself.
I love the idea of a plant point idea and aiming for
Me
30
too.
different plant types a week. That was based on a research study that showed that those people who ate more than 30 different plant types versus those who ate around 10 different plant types had a much more diverse microbiome. Am I correct?
That's right, yes. And actually, a lot of people think that it's quite difficult to achieve,
Mm.
but it's not. So when you start to obviously make changes in your diet, whether you're doing it by yourself or with a dietitian, you take one small step at a time. I think change is always really challenging. So people sometimes don't like change, but there are ways to incorporate more of those foods into your diet. And what I generally find in my clinic with patients that they've tried one type of food a long time ago, they didn't like it, and then they just can't. But let that experience not ruin the whole thing. I think different spices, different herbs that can be added, different ways of cooking with those sort of vegetables, or maybe as part of another dish that you can add it in. I think those sort of ways are practical, they're very easy to implement, and generally result in a larger variety and larger diversity of the plant foods in your diet.
Fabulous. Now, what should we be avoiding if we want to look
Okay,
after our gut health?
another question. I mean, of course, there are certain foods that one should avoid as part of the healthy eating. So, looking at how many processed foods are in your diet, really high fat, sort of high fat foods, high fat diet, high salt. Generally, sort of those foods can influence gut microbiota. Not just the foods that can do, but also things that you take, for example, medications, and overuse of antibiotics is generally one of the reasons why people have less diverse gut microbiota, because obviously, especially if it's a wide spectrum antibiotic, it tends to kill off quite a lot of bacteria. So I think looking at your lifestyle in general, so your diet, avoiding sort of a lot of takeaways, processed foods, and actually dieting can have a profound effect on gut microbiome and on the microbiota. So avoiding those sort of fad diets, where you restrict certain types of food, especially if it's aimed at restricting a lot of whole grain foods, because obviously we know that whole grains are a great source of different types of fibers. So yes, extreme dieting can actually influence gut microbiota in days. So, but the good news from that, the take home message is that if you change your diet, you can actually influence your gut microbiota, and you can improve it and you can boost it. The other thing is alcohol. Obviously, if you're drinking in excess, I think alcohol can be detrimental to gut microbes. So watch your alcohol intake. An odd glass of wine is absolutely fine for those polyphenols, but if you're overdoing it, it's definitely a gut irritant, and it does have an effect on the population of the gut microbes. Stress is one of the things that we always assess in our clinic. So we know that we live in a very stressful world, and especially in the last 2 years, it's been really stressful with COVID and everything, the social isolation and all of those, maybe working from home, not being very social. So I think stress plays a huge role in our gut health, and we need to address that. We need to find ways to relax. We need to find ways to maybe meditate and also be more mindful. So I think we've forgotten how to be mindful, and it's definitely something that we need to learn how to do. Mindful even when you eat, because let's face it, a lot of times we eat on the go, we don't chew our food well. we are rushed, we're not sitting down, we're eating it in front of TV or maybe in front of the laptop whilst we're working. So it's sort of like not very with it when we eat. So we don't savor the food. We don't know what it tastes like. It's just a process of literally like gulping down. And not chewing your food actually has an effect on digestion. And often we do see clients who have tried millions and millions of other things. You know, they've taken a lot of supplements to help with their digestion, but it actually all came down to the fact how they eat and in what quantities they eat. So that is a really interesting thing. So when you're thinking about digestion, when you're thinking about gut health, start from the mouth. So how you eat is also very important. So chew your food well, be a little bit more mindful when you eat, take your time, savor your food. So yes, and you know, obviously looking at the stress levels, anxiety, and all of that, we know that there is a connection between the brain and the gut called brain-gut axis. There is a lot of research going into it, and we know that they communicate bidirectionally. So they communicate with each other and obviously influence each other as a result. Sleep, another thing. So sleeping is actually wonderful for our gut and for our microbes. We do know that in like shift workers or when you're jet lagged, I mean, that could potentially affect microbes. And because they're just like humans, have a sleep awake cycles, what we call circadian rhythms. So it's really important to get that good quality sleep in, and to ensure that you wake up rested, to improve your gut health.
Wow, that is a fantastic long list. I hope everybody's taking notes, but this is being saved, so we'll share it to you afterwards if you missed some of those top tips or you just joined us. What about probiotics, prebiotics? We've had one question that's come up about probiotics. Maybe you want to explain quickly what the difference is between the two and whether or not we should think about adding them into our diet.
Sure. So probiotics are actually live microorganisms. So they are bacteria. So we can get natural probiotics in fermented foods, for example, such as kefir or, miso or tempeh. Or you can get it as a supplement. Okay, so then the definition of probiotics is microorganisms when administered in adequate amount that will confer health benefit to a host, so to us. So when we are thinking about supplements of probiotics, generally, if you're healthy, you're symptom-free, you don't have any conditions, they're not needed to support general well-being. So there is no science to say that you need a probiotic for everyone on a daily basis. However, there are conditions that you may want to consider a probiotic as an additional therapy. They're very strain specific, which means that, you know, it's like taking a painkiller to lower your blood glucose, you know. So when you are finding a probiotic, you need to look at something that is very strain specific for your condition. And I think that's where dietitians can be of help. So when you are coming to see a dietitian and we're going through assessment, we can definitely see if there are any evidence-based probiotics for your condition. Generally, things like traveler's diarrhea, for example, we know that a probiotic would be very helpful, or taking probiotics with antibiotics is really helpful. We know that sometimes with constipation and diarrhea and IBS, certain types of bacteria, probiotics are really helpful. I think, you know, when it comes down to general well-being, the advice and the current consensus, you don't need to take a supplement. In terms of prebiotics, so prebiotic is food for bacteria, which is a completely different thing. Again, you can get prebiotics as a supplement, and again, the same advice. If you are generally well and your diet is balanced, you've got some plant foods in your diet, You don't need to take an additional prebiotic. That's not something that we'd recommend. Prebiotics generally are fibers. There are three different types of prebiotics. So you've got inulin, you've got galactooligosaccharides or GOS. So GOS, sometimes you will see it on the supplement, or fructooligosaccharides, so FOS, FOS. And they are actually part of a lot of fruit, vegetables, legumes. So you can get them naturally in your diet. And this is what's encouraged. So there is a brilliant post by the Gut Health Clinic on pre and probiotics that people can refer to if they want a little bit more information on where those pre and probiotics are.
That'd be amazing. Maybe we can add the link when I save this. We'll add as a link to the comments underneath this chat.
Yeah. And generally, as I've mentioned with probiotics, if in clinic we see a particular client who we think may benefit from prebiotics, we would recommend, but it's on a case-to-case basis. So not for general population, I wouldn't say.
So why would it help to go and speak to a dietitian if you want to sort of work on your gut health?
Well, I think it can be a daunting thing to, obviously, if you think about gut health and you've got quite a lot of issues, so you've got a lot of symptoms that you've lived for a long time with, it can be a challenging thing. You don't know where to start. So as dietitians, we are obviously qualified in terms of any therapeutic diets, but also sort of performing a full assessment, taking into account not only the current symptoms, but obviously doing a thorough assessment, more of a holistic, so taking other things into account, so other conditions that person may have, because it's not one size fits all. So you need to be very sort of individual in your approach. You need to tailor your advice to that particular person, because there are a lot of things to consider. Just to mention with probiotics, for example, I think they're generally considered to be safe, but there are people that actually would have to be careful with probiotics. So those things like that, or maybe, the interactions between the medications and certain supplements that you would be taking. So, and obviously reviewing the diet. I mean, who, if not dietitian, would know how to improve, how to incorporate some of the things in terms of making it more practical. So, for example, we see a lot of people who are very busy and they don't have a lot of time to cook. So we may come up with a plan that would fit with them in terms of meal prep, or, just getting your head around how you can actually incorporate some of those plant-based foods into your diet if you're really busy, if you're on the go. I think that could be really challenging when you first start off. And as I said, especially if someone is worrying about their gut health and they want to improve it, but don't know where to start. A word of caution, obviously, if you are experiencing any gut symptoms, that are new to you and you worry about them, please go and see GP in the first instance, because there are a few tests that they can do to make sure that there is nothing sort of that outside of just an occasional bloating or just an occasional sort of excessive wind or diarrhea. So there are a few.
I think I've lost Anna. Connection with Anna. Hopefully she'll come back. Because I was hoping we've got one more question to go as to where we can get some more information and where you can go if you want to read up more on this topic. I think we lost Anna. Maybe her phone ran out of battery or something like that. But I will, the last question I was going to ask Anna is where you can go for reliable information if you want to read up more on gut health. I will, oh, here she comes. Excellent. Let me get her to come back in. I think she's going to join now. Yay!
Hi, everyone. I don't know what happened there. I apologize. I don't know. Yeah,
don't worry. It doesn't matter how much one does this. Technology has a mind of its own. So I was literally going to get into this last question, which was, well, second from last, because now I've got you back, is, you know, if people want to go away and find out more about gut health or read up more about gut health and what they should do for their gut health, where can they go for good, reliable information that's based on science? You know, yeah, any tips on that would be great, Anna.
I think in terms of the websites, we always recommend reputable website like British Dietetic Association. They have a lot of food fact sheets that are broken down into very manageable, easy to understand, user-friendly information. So instead of going, you know, reading a lot of research papers with a lot of jargon and not understanding really what they're talking about, I think it's best to refer to those type of websites where you've got reputable information, and sort of easy to digest information as well. Things like Nutrition Society, I mean, websites such as Nutrition Society or Vegan Society. If you are vegan and you want to improve your health, your gut health, you can also go to those websites. I want to say that the founder of the Gut Health Clinic, Dr. Megan Rossi, has got the most amazing books out. I've got both of them here. They are actually absolutely brilliant, wealth of information, all science-based, and also adapted for everyone to use. So some of the validated questionnaires that you can actually do at home to assess your gut health, to see how you can implement, you know, different types of plants. Loads of visuals, loads of excellent information. So definitely would recommend those two books. And if you want more advice, which is more of a face-to-face, one-to-one, individualized advice, you can always get in touch with us. We've got a team of gut health specialist dietitians at the Gut Health Clinic, and we will be able to help you.
Brilliant. And if you're going to leave everyone with one final tip of what they should think about when it comes to gut health, what would it be?
I think plant foods. Just have that plant food cap on. Think about diversity. So diversifying your plant foods in the diet. I think that's generally something that I would recommend to everyone. And definitely if you want to improve your gut health, if you want to feed those microbes, yeah, and generally when you're sitting down to eat, maybe ask yourself a question: would my microbes love that?
I love that. Fantastic. Thanks, Anna. Thanks so much for
You're
today.
welcome.
And thank you for everyone for joining us. And we'll save this so you can catch up. Take care. Thanks, Anna.
You too. Thanks. Bye.
Bye, everyone.